Hello and welcome. Thank you for joining us for this session of COVID questions and answers by campus leaders. We'll do introductions in a minute, but we want you to please share your questions in the Facebook comment section. We will take as many questions as we can and provide you with the best answers possible. So I'm Stephanie Blaisdell. I'm the Vice President for Student Affairs. My pronouns are he, she, hers, and I will turn it over to our president, Don.
Hi, everyone, and welcome. Don Christian, president, pronouns he, him, his. Thank you.
And next up, we have Barbara, our interim provost.
Good afternoon. I'm Barbara Lyman, interim provost and vice president for academic affairs.
And Dr. Ordway.
Jack Ordway, I'm the Director of Student Health Service.
And Jordan.
Hello, everyone. My name is Jordan. My pronouns are he, him, his, and I'm the Student Association President.
Shelley.
Hello, I'm Shelley Wright. I'm the Chief of Staff and Vice President for Communication, and my pronouns are she, hers.
Jenny.
Hi, I'm Jenny Mockren, Dean of the School of Fine and Performing Arts, she, her, hers.
Stella.
Hi, everyone. I'm Stella Turk. I'm the college registrar.
Mike.
Hi, everybody. My name is Mike Patterson, Assistant Vice President in Student Affairs. I oversee areas which include residence life and our student engagement areas.
And Steve.
Steve Deutsch, I'm the Executive Director of Campus Auxiliary Services, and I'm responsible for dining services on campus.
So again, we are here to answer questions. If you have questions, please do share them in the comment section in the Facebook page, and we'll respond to those as they come in. I believe hopefully folks are aware that our deadline to meet the SUNY vaccination policy is Monday. We have heard from most of our students at this point that they have either fulfilled that deadline or are in the process of doing so, perhaps waiting to become eligible for that second shot. So currently 93% of our students, our in-person students, are vaccinated and have provided that proof to us, which is wonderful. Another 3% have received approved medical or religious exemptions. So our compliance rate right now, the percent of students who are cleared is at 96%, which is wonderful. So we hope that we will be hearing from those remaining in the next few days. Monday is the 27th, so we are nearing the deadline. And if there are students who have questions, concerns, they can contact my office, this Office of Student Affairs, and that number is 845-257-3260, and we can handle individual situations as they emerge there. Dr. Ordway, would you like to talk at all about the Moderna pop-up that will be on campus on Monday?
Yes. On the 30th of August, we had, well, actually, shortly before the 30th of August, we got an offer to have a pop-up clinic to try to help students get immunized by the 27th of September. So on the 30th of August, the Moderna pop-up occurred, and the turnout was a little bit less than we hoped, but I think we had 30 people who got vaccinated, and their second shot will be given on the 27th when the county is here again. And the county has said that they may have some J&J vaccinations to bring along also. So that would give other people an opportunity to get vaccinated at the last moment.
Jenny, as a member of the testing committee, would you like to speak a bit about our available testing on campus and who needs to be tested when?
Sure. So testing is available weekly. We have the schedule published live. Stephanie, could you put a link to that for them, to the testing site? You do need an appointment in advance. We have 2 schedules currently running for students. Students who live on campus go to testing based on which residence hall they live in. And students who live off campus go to testing according to their major. And those are live online, but you also should be getting notified by either your residence hall directors about when your testing is, or by your department chairs.
Thank you. So we have a question. What is the college doing to increase the vaccination rate among employees, which currently is at 77%? While the dashboard indicates that only 4 employees have tested positive, it's so important that as many people as possible on campus are protected, to follow through with the we, not me philosophy. President Christian or Provost Lyman, would one of you like to talk about that?
Sure, I can comment. One is that we're encouraging the employee unions to encourage to be partners with us in encouraging their members to be vaccinated. We agree completely that we want to get that vaccination rate up higher for employees. We do know that there are some employees who apparently are vaccinated but simply have not bothered to turn in documentation of their vaccination, and so we're working on that piece as well.
Thank you, and thank you for your dog's response too. We have another question. Can something be done about the number of non-students that walk their dogs around campus smoking cigarettes without masks on? We are an open campus. We're a state facility. So we do allow visitors on campus in some instances inside buildings, but we expect them to adhere to policies. Our current policy is that everyone, regardless of vaccination status, does have to be masked indoors, but masks are not required outdoors. And that is because transmission rates are low, or very little evidence of any transmission that takes place outside. So people walking on campus really don't pose a threat to our community unless you were to stand in very close proximity and have a prolonged conversation with that individual. So we don't have any requirements for anyone, student or non-student, to wear masks outside in these circumstances. We do wish that our campus had been able to make the progress that we had hoped for around becoming a smoke-free, tobacco-free campus. We did put that initiative on pause due to the pandemic. Anyone else want to comment on that?
Maybe worth noting that we do have a leash requirement for people walking dogs on campus.
Yeah, there is an ordinance, village ordinance, New Paltz ordinance requiring leashes. So we do abide by that. The next question is there a move to do away with the religious exemption for vaccines on campus? What is the threshold for a religious exemption? So that is a decision that we can't make as a campus. That's a state requirement. Well, if you're following the headlines, there's some controversy around not allowing religious exemptions, and plenty of lawsuits that will help settle that question in the long run. But for now, we are following the state guidelines to allow for religious exemption. We do have a unified process across SUNY to handle those exemptions. Mike, would you like to comment on that further?
Sure. So the religious exemption, basically what we're looking for, the student has to provide a statement or testimony or demonstrating their religious affiliation and how they attest to and follow the premises of the religion. That has to be notarized and witnessed by a public notary, so that way they're making that statement publicly. Along with that, they also have to acknowledge the conditions about what it means to have a religious exemption, in terms of if there is a breakout on campus, that they would may not be able to come to campus because of a high breakout rate. And then any other, we have 4 acknowledgements that they have to recognize when they complete the exemption request.
And is it worth clarifying that those with religious exemptions are required to test weekly?
That is correct. Anybody with a religious exemption does have to test weekly and comply with all of our campus policies as well.
Which applies to anyone who is not fully vaccinated. So there is a little bit of a distinction there, a nuance that some students get confused about. To comply with Monday's deadline, you must have completed the full series of vaccinations. So with Johnson & Johnson, that's 1 shot. With Moderna, Pfizer, or vaccinations that are available in other countries but have been approved by the World Health Organization, that's 2 shots. So both shots must be completed before you can submit your vaccination proof to campus. But after your series is completed, there is a 2-week period before which you are considered fully vaccinated. That's because it takes time for your body to adjust to the vaccine and truly be able to fight off the virus. So during that 2-week period, you've completed the series, but you're not considered fully vaccinated. And during that time, you must continue to test weekly. So those who will have to continue to test weekly are those who are not fully yet vaccinated, or who have either religious or medical exemptions. Next question, who pays for the weekly testing for staff and students? That process that we're offering on campus is through a third-party vendor called Enzo Labs. They are providing testing for a number of SUNY campuses and other organizations. They provide the testing and bill the individual's insurance. If an insurance claim is not approved, which we have not seen except for in very rare circumstances, then the lab does an automatic appeal to the insurance carrier. If that's still not approved, then the university acts as the co-insurance in that instance. If an individual doesn't have insurance for some reason, which we do have very unique instances of, for example, a student who is only taking a class is not required to have insurance, then there is a federal fund that is available for students to apply to, or for individuals to apply to. All they need to do is let Enzo know about that situation, and Enzo is making the request or the funding request for those to be paid in that manner. So, we certainly are monitoring that situation. There may be a time in the future where insurance companies are no longer covering those claims, in which case we will take that into consideration with our testing procedure. Are vaccinated students who have symptoms like a headache or cold symptoms being asked to stay home from in-person classes to limit the spread of Delta, to limit spread of COVID? To avoid my talking through all of these things, would Don or Dr. Ordway, would you like to respond?
Sure. This fall, we knew that there's going to be some respiratory infections. There wasn't much last year. So there will be symptoms, and certainly if somebody has symptoms, we will want them to symptoms that could be compatible with COVID. We want them to stay home. We're asking the faculty to be, to realize that these, symptoms will keep the students home. So they'll be lenient, with their absences, because we just don't want, somebody who is infected to go to class. We do ask that when the students contact us, which many do, we ask them to get tested, and then we will have them wait, not go to class until their test is back and they're cleared. So it's yes, I mean, we're trying to keep students who might be infected, and if they have a symptom such as loss of taste and smell, that's a pretty, that goes along with this virus, so that's pretty sure that they may be infected. So want to be very careful with those, but there are a lot of people with other symptoms that we want to be careful with too. And we're trying to do our best to let people have educational experience while keeping the campus safe.
Jordan, I'd like to give you an opportunity to relay sort of the voice of the students in this forum. So if you have a statement that you'd like to make on behalf of Student Association.
Thank you. What I would say first on behalf of students is that even though we're getting vaccinated this time around, please keep in mind to continue to follow the safety protocols. Even though we're all fully back in person, doesn't mean we could just be wild this semester, considering that we're still very much so in a pandemic. For those who have religious and other sort of exemptions, please continue to follow the safety protocols. We have testing weekly for you guys, so please just test. Beyond that, in regards to Student Association, for any clubs or organizations that are traveling, it is required for you to test before and after you travel. So if you were to be traveling for a baseball game or any sort of event, you do need to get tested before and after you return. I think that's all I have.
Great, thank you. Steve, would you like to say anything on CAS's behalf or Sodexo or other services?
Sure. So we've been working with the Ulster Department of Health, and all of our eateries that are open are cleared for the occupancies that we have. Sometimes we have challenges with having people actually wear their masks when they should. When you're seated and you're at a safe distance, you're allowed to have your mask off, but when you're walking around, you really need to have that mask on. And that's probably our biggest challenge. So the message I'd like to send out, please, is that while you're walking around in any of the eateries, please make sure you have your mask on.
Great, thanks, Steve. Michelle?
Hi, I'm Michelle Halstead. I'm the Vice President for Administration and Finance, and I oversee facilities and IT, as well as a number of other departments on campus. But for facilities, I can say that we, throughout the pandemic, have been following all CDC and SUNY guidance as far as cleaning and disinfecting goes. But I think the science is saying that, and Dr. Orway can correct me if I'm wrong, but the science is saying that spread of the virus through contact of surfaces is not what it was once believed to be. So the cleaning is done daily, but not in between classes. And I think a lot of people expect that we have enough time and staff to go along between class times and clean and disinfect a room. We do not, but nor is it warranted. So we're doing the best that we can with the crews that we have to keep the campus safe from a facilities perspective.
Great. And Michelle, were you wanting to respond to someone that you wanted to reach out to you?
I'm sorry, Stephanie Bryant had listed a follow-up question. She wanted to know who she could reach out to, and I'm assuming it's about the dogs and the smoking. So Stephanie, you can reach out to me at HALSTEAM, as in Michelle, at newpaltz.edu, and I'll be happy to continue the dialogue.
Provost Lyman, would you like to say anything on the academic portions of these questions?
Thank you. I don't mind reinforcing some of the points that have already been made. We have faculty who have a history and of willingness to work with students in ordinary times, you know, the pre-COVID times, so that students who needed to be absent for brief illnesses or for any other reasons, you know, faculty have shown themselves over and over willing to work with students, and we've asked them to continue in that vein. In a sense, it's more important than ever, as Dr. Ordway has alluded to make sure that students who are not feeling well and who are exhibiting signs that suggest the possibility of having COVID, it's very important. We remind faculty, and faculty have certainly been exhibiting willingness to hear this and to act accordingly, that they don't enforce absence policies that would tend to make students who are not feeling well have those signs and symptoms possibly of COVID, and you know, to do things and to enforce those policies in a way that would make those students, those ill students, want to come to class. So we continue to rely on faculty's willingness to work with students, and they have continued to demonstrate their willingness to do that.
Thank you. Shelley, would you like to talk a bit about the vaccine deadline and what a student's options are if they miss the deadline?
Sure. So the deadline is, I hope many of you know, it's September 27th. And, you know, we know there are some students out there who have no campus presence this semester, and they have been contacted about filling out an attestation, which essentially says, you know, I do not plan to come to campus this semester. If they do come to campus during the semester at any time, they will need to be showing proof of vaccination. And then obviously we also have the religious and medical exemptions. What's going to happen is after the 27th, we will be looking at who has not done any one of those things, and we will be withdrawing them from their courses for the fall semester. So it's a very serious consequence. It's a SUNY-wide policy that we are implementing here, and you know, our hope is that we can work with students ahead of the deadline to make sure they've taken one of those steps so that they can remain enrolled in school.
Stella, do you want to add anything to that?
I just also want to remind students that in the next week, there will be, the scheduled classes will open up for the spring semester. Students should be mindful not only of making advising appointments and being aware of how advisors plan to meet with you, but also if you are in all online courses this semester, you still will need to be able to either demonstrate that you've met the vaccine requirement, or you will have to, once again, fill out an attestation. We'll have to go through a process to be sure that you would be able to get registered for the spring semester. So just keep in mind that if you are online this semester, the vaccine requirement will still apply for next semester.
So the next question is, why did your university choose to wait until students were already enrolled to mandate vaccinations? Now they basically don't have much of an option on whether they want to get vaccinated or not. For those that are not vaccinated, their only choice now is to get the 1-dose Johnson & Johnson. So we had hoped that the FDA would give regular full approval to Pfizer before the semester started. It was rumored that it was going to happen, and it didn't happen. We legally were not able to require vaccinations until that happened. So we did message beginning in late spring, early summer. There were many announcements in headlines and other places indicating that this was going to be the policy as soon as that regular approval took place. So once the approval happened, we very quickly messaged the community what those options were. And it's unfortunate that the timing was after the semester started, but we hoped to give that messaging up front so that families could make informed decisions about where they attended school this semester. This is not our policy, it's a SUNY policy. So this applies to all of the state universities. So we're following that policy, but that's why the timing was later into the semester. Shelley?
Yeah, I'd just like to add that we've been using our texting capabilities to reach out to students that have not provided proof of vaccination or have not applied for and received an exemption. We've been using email. Obviously, today we're doing a Facebook Live event. We've been pretty consistently messaging those folks starting in the spring and then, continuing once Pfizer was approved. So just wanted to point that out, that there's been numerous communications. We've been messaging parents as well, because this is such an important decision, and the consequences, including 100% liability for tuition, is, it's important that everyone meet the deadline.
President Christian, this next question is for you. Are professors, is there any understood and articulated threshold of infection at which the campus would pivot to an all remote learning?
I think it's, an important principle there is that if there is an uptick in COVID cases, it almost certainly will be a decision driven by SUNY or by the New York State or county health departments about a pivot to more broad distance education. So that's very unlikely to be a decision that would be left to the discretion of individual campuses.
We certainly are monitoring our situation here. And if you go to the website, there is a COVID dashboard. Currently, we have 15 active student cases and 0 employee cases, and our positivity rate is 2%. So we are coming off of a higher number than that and excited about that trend. We hope that trend continues. We are doing our best to live within a bubble. We are not a bubble. We are not removed from the larger community. And even at our peak, we actually were doing much better than Ulster County, which immediately surrounded us. So we do think that our policies are working. Our policies are keeping us safer. When it comes to public health, it is not harm elimination, it's harm reduction. So we are doing all that we can to create a safer environment. The next question is, are professors mandated to be—
Stephanie, before we leave that one, it may also be worth pointing out, if I can get my fingers up here, that SUNY on its dashboard of COVID data keeps a running count of, it's a 15-day total count of COVID cases. So it's day 1 through 15, and then the next day is 2 through 16. The day after that is 3 through 17, and so on. And our case count has been declining quite impressively in the last week or so, which we're very heartened by, and we think that reflects the dedication of everybody to our masking mandate and also the increasing vaccination profiles.
Thank
Sorry.
you, President. Yep, no, that was great. Thank you, President Christian. Provost Lyman, are professors mandated to be vaccinated?
Thank you for the question. And with regard to our faculty, who are, of course, among our employees, then we have the same policy for them as for all other employees with respect to vaccination. So we are in a position to highly recommend and encourage, but we do not have that as a mandate for our faculty. I would say that, and of course it is more anecdotal than anything else, faculty do appear to, if I may generalize, just have confidence in known measures that increase our safety, including vaccination. And, you know, sometimes this comes through indirectly. We have vaccination, we have the multiple layers of protection, the masking, and so on. So we believe that faculty are, you know, by and large, predisposed to seek all and to engage in all the safety measures that we have. They also commend our students for, you know, doing the same. One of the comments that most of us have heard multiple times is how pleased the faculty are. They're certainly pleased to report it. Those reports that I've heard to say that students in their classrooms are adhering to our mask wearing policies. And I've heard multiple times just how faithfully our students are adhering to that particular safety measure.
And it may be worth adding there that many of our employees are represented by statewide unions. And so the decision about a mask mandate for employees is really beyond the purview of campus leadership. And that's one of the underlying dynamics in that figure.
I said thank you. That's the part that I was muted for. We are pleased that questions have been a little bit slow in coming. We hope that that's because we've done a good job of communicating prior to this forum. We have done, as Shelley indicated, we've done a lot of messaging. Our students probably wish that we would do a little less messaging, but it is an always evolving situation. So we are trying to be clear about important messages that our students need to be aware of. In addition to the messaging that we're doing, you can always look at our New Paltz Forward information, our frequently asked questions that are posted on the website. That is really the best source of information, and we are always updating that page. So with most of the questions, I think, having been addressed at this point, we do want to leave you, I'm going to let our president of Student Association have the very last word, but we do want to leave you with the message that we are just so happy that students are back on campus. We had students last year, but not in the numbers that we have them this year. We are happy to have residence halls populated again. We do have over 2,500 students living on campus. We have, most of our classes, roughly 90% of our classes are in person or hybrid this semester. And we sure miss the vibrancy of having that dynamic campus last year. So our students did an amazing job last year of keeping our campus safe. We stayed open. We did a good job complying last year, and our observations are very similar this year, that they are doing what they need to do. They're thinking we, not me. and making good decisions about helping our campus stay safe. So we fully intend to continue on for the rest of the year and more so, and be in person. And we just are so grateful to be here to work with students, and happy that you're having the experience that we're able to give you this year. So with that, Jordan, would you like to say a bit about what's going right with students and student association this year?
Well, what I would say has been going right is that as a student association have received overwhelmingly positive feedback about what's been going on with the vaccinations and with students and professors masking and following the safety protocols. Beyond that, student association is also in charge of all the clubs that exist here on campus. And as that pertains, students who do attend those clubs and organizations have also been abiding by those rules and been having, like Vice President Blaisdell said, like the campus is very vibrant. Once again, the residence halls are populated, people are following safety protocols, and everything is safe once again. So we do hope that moving forward, even after September 27th, that students and faculty can continue following the safety protocol and keep in mind the campaign of We Not Me.
Great, thank you very much, Jordan. And we will continue to respond to questions that are left in the chat on Facebook. So feel free to continue to chat for a few more minutes. And thank you again to our panelists. Thanks for being here, and thank you for the questions. And again, if you have questions beyond this session, you can notify any one of us. My office is, the Vice President for Student Affairs. It's 845-257-3260. Thanks, and have a great day.
Bye.